Children with epilepsy often experience issues related to sleep. As a parent or caregiver of a child with epilepsy, including a severe form called Lennox Gastaut syndrome, you should fully understand the importance of good sleep.
There are many reasons why children with epilepsy, and specifically Lennox Gastaut syndrome, may have sleep problems. Some children are overweight, which can disrupt sleep. Some children are on medications for their epilepsy, which can disrupt sleep. In some children, the sleep problem itself is related to the brain issues that cause the seizures or the wiring problems that resulted in the brain malfunctioning.
Sleep disorders that affect your child may include excessive daytime sleepiness, obstructive sleep apnea or a blockage of airways, poor sleep architecture, which is not getting the proper cycles of sleep, or all of the above. Sleep disruptions are closely associated with attention and behavior problems in the daytime, so it's important to understand the terms used for the different types of sleep disorders so you can identify and discuss them with your doctor.
There are multiple ways that a child's sleep disorder can be identified. An important way is for a parent to note on their seizure diary when children go to sleep at night, when their child wakes up in the morning, and if their child is extremely sleepy during the day. This can give the healthcare provider a chance to see whether follow-up studies, for instance questionnaires and some simple tests, may be useful to further elucidate or identify if a sleep disorder exists. Lastly, a more formal test called a polysomnogram may have to be done to fully identify and characterize a sleep disorder.
Both children and adults sleep best when they adhere to a regular sleep schedule. For this reason, you should try to ensure that your loved one goes to sleep at the same time each night. Your child's room should be optimized for sleep. The bed, pillow, and blanket should be comfortable, and the room suitably dark and quiet unless the child is fearful of the dark. It's essential for your child to prepare for a good night of sleep in the hours before bedtime. Patients should avoid active play or eating stimulating food or drink, such as chocolate or caffeine.
Sleep hygiene describes the entire experience around getting ready, going, and staying asleep. It's important for parents of children with Lennox Gastaut syndrome to recognize that what happens in the hours before their child goes to bed, what they eat, what they do, how they actually get their child to bed, where they let them lie down, what they let them do in their bed, and then how they handle their child having trouble getting to sleep, all affect their child's sleep hygiene.
Sleep disorders impact not only the patient, but the caregiver as well, who is often awake caring for their loved one. That's why it's essential for caregivers to work with their child's physician to identify and address sleep problems to help maintain the whole family's quality of life.
Poor sleep hygiene can lead to sleep disruption, which then can lead to poor quality of life and worsening seizure control, which can affect not only the patient but the entire family. At times, seizure control and quality of life can both be improved by correcting sleep hygiene. Therefore, it's critical to recognize when poor sleep hygiene exists in your child with Lennox Gastaut syndrome and to partner with your healthcare professional to design therapies to try and improve it.
For more tips on dealing with sleep disturbances in the LGS patient, browse within www.livingwithlgs.com.